The coronavirus pandemic continues to spread across Minnesota. Almost 4,000 cases reported today for a third straight day of record-breaking new cases.
And the state's positivity rate now is at a worrying 9.2%, with the State Department of Health reporting that 92% of ICU bed capacity is being used. Our Alex Tejada explains how the surge across the state is impacting us here in the Rochester area as well. Alex?
Tom, Caitlin, weekly cases in Olmsted have doubled, averaging about 70 new cases per day and even reaching a positivity rate as high as 14.7%.
Our case investigation team is experiencing a little bit of a backlog. They are working as fast as they can, but they are a few days behind.
Barely keeping up as the virus races through Olmsted County on the backs of young people. The age range 20 to 24 representing the highest population of current COVID cases.
If you were to go and meet some friends for happy hour today, maybe you're not at risk, but maybe that bartender has diabetes.
Which makes any kind of gathering, no matter how small, something of a risk.
These small gatherings as well as our households are where we're seeing the majority of transmission still occurs.
While Briggs adds that people cannot live in a bubble for months, he does point out that people's COVID fatigue is becoming a problem for the healthcare system.
But at the same time that we're seeing increase in community spread, we also see our healthcare workers who are part of the community also becoming infected.
As staff is forced to quarantine and miss work, it means backup plans are needed.
We expand that, saying, well, what if it gets worse than that? And we keep developing more and more contingency plans for staff, space, and supplies.
In some places, it has meant pausing elective surgeries, something Dr. Pritish Tosh says is a consideration, but should only be done if absolutely necessary and will not cause negative health impacts.
But we will make the decisions based on what the patient care needs are, not just the COVID patients, but the patient care needs across the spectrum.
It's a situation that's dire, but not hopeless.
Well, the answer is you can wear a mask. You can practice good social distancing. It is proven to save lives and to keep people healthy. And that is what we have to really commit ourselves to.
We've said it before, we'll say it again, that this is a marathon and we can't sprint to the finish line.
When asked about a potential shutdown, Briggs says he does not believe Minnesotans would be receptive to it and instead preaches to people to follow health guidelines. The county health department also reminds residents that cases related to last week's Halloween parties and the campaign rally have not yet begun to affect our region. It makes decisions surrounding the Thanksgiving holiday even more important during what Briggs is calling a critical point. Reporting live in the studio, Alex Tejada, KTDC News.
Alex, thank you.